Hi, this is Dr. B from My Diabetes Home. Let's be the boss of our blood sugars and plus tips on diabetes spring cleaning. It is important to check your sugars because that's when you know where you are, and then you can control your sugars. If you check your sugars and improve them, you will have better quality of life, you will reduce your risk for long-term complications, and finally, when you take it to your doctor's office, they will be able to give you the right treatment and medications for you. What should the sugar targets be? ADA says 80 to 130 before meals and less than 180 1 to 2 hours after. I also have ACE blood sugar targets here. I've tried to simplify them: 80 to 120 before meals, less than 160 other times. Your targets may need to be personalized based on your age, the medications you take, and if you have heart disease. Talk to your doctor about that. How often should you check? These are ADA recommendations and my recommendations. To simplify it further, I just tell my patients check one more time than the number of insulin shots per day. So if you're not taking any insulin shots, about once a day. If one shot a day, then twice a day. Do vary the time of the day. Check before and after meals. Check before and after exercise. Check before and after sleep. That helps. If you wanted a fast way of giving a lot of information to your doctor for a visit, do a 7-point profile for 3 days before you go there. And that is before the 3 meals, after the meals, and bedtime. Always, always, always bring your blood sugars to the doctor's office. This really helps us make much better treatment decisions. Our goal and job is to help you, and we can help you much better if you bring your sugars. Track them on paper if you want, track them on an app, track them on My Diabetes Home manually, and enter more information about those sugars. I find this very valuable on my patients. You can also then understand these sugars. You can also know at a glance what your A1C could be. Did you know that at My Diabetes Home you can also upload a number of meters? And here is a list of the meters we have. Spring cleaning. Very important. Get rid of the medications and things you don't use. You can take them to your pharmacies or to the police department, or you can dispose of in the fashion I describe here as well as a last resort. For your medication that you want to share, please share. These are 2 ways to share: SafeNet RX or Echo Returns. Please go to these websites and look up if you can share your medications. How about the syringes, stress strips, and lancets? Well, put them in a biohazard container. As a last resort, you can put in an empty laundry detergent container and then get rid of them at a site that you can find at this website. Please go ahead and check it out. All right, bringing it home, the key takeaways. Your sugars, check them. It tells you the story of your diabetes. Tracking makes it possible for you to meet targets and live a happier, healthier life without complications. Be the boss of your sugar and then make it work harder by always bringing it to the doctor's visit. And then please, this is the right time, focus on spring cleaning for diabetes. Thank you for listening. Here's my quote for this webinar. Let's work on changing your diabetes together.